Essentially, we want to kind of assess how the pandemic response has impacted the stress levels and mood within this cohort of women, in particular depressive symptoms. As we know that the pandemic has brought on a lot of changes with regards to how we go on about our everydays, whether it's work or simply going out for groceries or even just visiting friends and family, that's been impacted.
Interestingly, around 2007, there was this maternal experiences survey which used a number of validated tools to look at pregnant people's perceived stress and their childbirth experiences. And this is a rich data set that is available for comparative use. So what we did is we used some of these same validated surveys in order to be able to compare a pre and post-pandemic cohort. And then there's also some sets of questions that are unique to being pregnant and having your care during the pandemic.
The purpose of the study is to look at the effect of the pandemic response rather than the pandemic itself. We know that simply because women are infected with COVID doesn't mean that they're not impacted. So that is essentially where the One Health approach comes in, and is a perfect framework because it allows us then to see how the restrictions that have been put in place have impacted how women are interacting with their daily lives.
We also know that the postpartum experience affects both the birthing person and their baby in both the short and long term. And so we know that perceived stress in the perinatal period may have a contribution to later life health, both again for the birthing person and for their children, in terms of overall cardiovascular and metabolic health, bonding experiences, and then risk of mood disorders as well. Potentially then we can help to find some interventions that help to alleviate some of these perceived stressors, and potentially flag people for people who might need a mental health intervention, or even a cardiometabolic health intervention going forward, both for themselves and their children.